So, quick story about Maria Perez. So I, as everyone now, is well aware of the fact I am a project coordinator for Sandoval County Health Council. I go through a tremendous amount of Zooms. We have a gazillion different trainings. We have different series, and they are incredibly helpful. I stumbled upon this particular series with Maria Perez one day, and I was like, oh my gosh, I need more of this facilitator of knowledge in my life. So then I went back through, and for those of you who are not aware, you can go to the website and you can look at the different trainings and whatnot, and they are absolutely worth the look. So to give you an idea, so she was born and raised in Ecuador. She immigrated to the United States in 1990s-ish to pursue her education. A seasoned nonprofit leader, organizer, facilitator, advocate, educator, and coalition builder. She is a firm believer in the power of people coming together to address complex social problems, obstacles, and challenges. She spent over 10 years as a healthcare practitioner before turning to policy, equity, and advocacy work. She served as a campaign lead and later as an intern hub manager for the California Endowment's project building healthy communities in East Oakland, the director of Fair Vote New Mexico, and a campaign manager for Common Cause New Mexico. That's a whole lot of work. That's a whole lot of advocacy work. She believes that democracy is the ultimate health equity indicator and devotes her professional work to ensure that the democratic process is accessible to all people. Maria started the consulting firm Democracy in Action in 2019. It is hugely successful, and launched the nonprofit organization Democracy Rising, where she serves as a co-director since 2020. So I strongly urge you to check out our previous trainings and whatnot. She's a phenomenal speaker. She absolutely, you're going to hang on every word. And without further ado, Maria Perez.
Wow.
I know. Well, the first time I heard you, I was like, oh, let me just keep driving. So thank you so much for being here.
Thank you.
Everybody.
And that's the camera.
Yes, right there.
All right. Hello, everybody online. Hello, everybody in the room. All right. So I'm gonna
1 second, Maria.
yeah, sure. We're gonna do a little training today around the advocacy issue. We're gonna talk about the difference between lobbying and advocacy. A lot of times people get a little nervous with those lines. So we're gonna have like a very simple, straightforward training on that. And then we're gonna talk about drafting an elevator pitch as it relates to advocacy, right? And you will do it a little bit different if you're allowed to lobby, as opposed to whether you're just doing straight up advocacy. So here we go. We're going to talk about lobbying versus advocacy first.
Just 1 second. We're not sharing on Zoom.
And Rebecca, if people have, like, can we pause along the way and have?
Yeah, I was going to ask, would you like to do questions along the way or at the end?
We can do it along the way. I'll
Okay.
just pause here and there.
Great. I will sit up here and let you know if you have any.
Okay. All right. So we're loading this up on Zoom. We'll start shortly.
Okay, you're good.
We're good?
Yeah.
Okay. So let's go to the next slide, please. Here's a little agenda for today. We're going to be together for about an hour. Welcome, everybody. We're going to talk about lobbying versus advocacy. Then we're going to talk about the elevator pitch. Why have one? We're going to go through some steps around what you need to do to prep for your pitch, draft your pitch, and practice your pitch. And for those of you, well, both in the room and online, if you have a little pad of paper and pen or pencil, we'll get to that. I'm hoping that it can be sort of like a practice, hands-on training today where you can actually prep and draft and practice your pitch as we go along. So let's go to the next slide, please. All right, thank you. Lobbying versus advocacy. So what's the difference between them? While all lobbying is advocacy, not all advocacy is lobbying. The main difference is that lobbying includes an opinion about specific legislation. So if there's a bill that's been introduced and you're going to ask somebody to support that bill, to oppose that bill, that's lobbying. And that's whether you do it with a legislator or you do it with the public. If there's a ballot initiative that's been introduced and you're hoping that people will vote for or against it, that's lobbying. As long as there's a bill that somebody's got to vote on, rule of thumb, that's lobbying. Advocacy is everything else, right? Advocacy is educating people on the issue. Even if there's a bill introduced, you can still educate people about the bill, about the issues that the bill is addressing, without asking somebody to vote a certain way. So that's broadly advocacy. If you are asking somebody to vote for something, then you are crossing the line into lobbying. You are allowed as a public citizen, as a private citizen, to lobby, to advocate, to basically speak out, right? This is First Amendment rights. You can do what you want. You can talk to people about the things that are important to you, but you have to be careful about lobbying. If you work for a government agency, sometimes for a nonprofit organization that does not engage in lobbying work, you have to be a little careful. So please do check in with your employer's policies about lobbying. Let's go to the next slide, please. All right, so advocacy. Remember, advocacy is the big umbrella and lobbying kind of falls within it. So advocacy is any action that speaks in favor of, recommends, supports, or defends, or pleads on behalf of others about any issue at all. You're basically just advocating for people in your community. You're advocating for a change. You're advocating for clean environment. You're advocating for funding in public education, whatever it may be. You're allowed to advocate. You're just telling people, educating them about an issue that's important to you, and hoping to change people's hearts and minds about it. In the broadest sense, advocacy is just education work. Whether it's you're educating the public, you're educating elected officials, you're educating administrators, whoever it may be, you're just sharing information with them and hoping that they'll gain a little bit of insight into what is important to you. Advocating for your issue involves just about any form of communications that as you or your organization or as an individual can do. So you can educate folks by having one-on-one conversations with them. You can call them on the phone. You can create little videos and share on social media. You can go to public meetings and share information. You can have a house meeting. For some of you that have participated in some of these advocacy trainings, right? We've talked about the one-on-one meeting. We've talked about house meetings. We've talked about public meetings. Advocacy does not urge those people that you're having conversations with to vote on any issue one way or another. Again, once there's a vote involved, you're veering into lobbying territory. You're just educating them on the issue, telling them why it's important to you, and hoping that they're going to be moved to also educate others or to think about maybe voting one way or another without you telling them to do so. Let's go to the next slide. Lobbying, on the other hand, is just a very narrow piece type of advocacy. It is communicating with decision makers about existing bills or legislation that they're going to have to vote on. And you're urging them to either vote for it or vote against it. Again, decision makers in this sense can be legislators, elected officials, who will be voting on a bill, but also it includes voters who will be voting on a ballot measure. So if there's a ballot measure, the ballot initiative campaign in your community, and you're going door to door to educate people on the issue, you know, the line there again is, are you just educating folks on the issue, or are you also asking them to vote for or against something that's going to be on the ballot? Rule of thumb, though, if you're worried about lobbying, there's 3 components that are necessary for something to be considered lobbying. 1, communicating with decision makers, which also would apply to advocacy. 2, you're communicating about actual legislation, which gets a little blurry, right, around the lobbying piece. And 3, this is the deal breaker, you're asking for their vote for or against that issue. So you have those 3 things, you are lobbying. Let's go to the next slide. Okay, so this is a side-by-side that helps you kind of figure out if you're not sure what it is that you're doing, if you're a little nervous about whether you're crossing over to lobbying when you're not supposed to, this is helpful. So in general, advocacy includes sharing best practices and success stories, or not success stories with folks, sharing nonpartisan research and its analysis. So if you have a report that clarifies the issue that you care about, or there's a website that talks about it, you can share about that. Updating groups or organizations on the status of specific legislation is advocacy, as long as you're not urging people to vote one way or another. And building coalitions about that issue that you're advocating about. So you can build coalitions around education, right? Last couple of years, there was a lot of coalition work around vaccines and vaccination programs with COVID. People were coming together, organizations were coming together, individuals were coming together to get education out. That's advocacy, right? There wasn't a bill associated with that. There wasn't a vote associated with that, but you were forming groups of people and organizations to spread the word to get your communities more educated. So that in general is advocacy. Now we're going to narrow it down a little bit to the lobbying part of advocacy. Lobbying advocates for the adoption or rejection of specific legislation. So we've mentioned that already 20 times. That's the key. If there's legislation, if there's a vote involved, it's lobbying. Preparing materials or arguments that support a position regarding specific legislation. So right now there's a bill, House Bill 49 it is, right? If you are preparing materials that educate legislators about what the health councils do, and you're saying, please support House Bill 49, that's a lobbying activity. If you leave that last sentence out about supporting the bill, then that's advocacy. If you're contacting legislators or their staff in support or opposition to specific legislation, that's lobbying. That's called direct lobbying. You do as an individual. If you're urging other people in your networks, your work, your organization, to contact legislators or their staff in support or opposition of a bill, that's called grassroots lobbying, right? So like you can lobby on your own. You can urge other people to lobby, that's called grassroots lobbying. And any strategy or coalition meeting that coordinate activities in support or opposition of a specific bill, then that's lobbying. So I hope that's clear. Let's pause there for some questions if we have any.
I have a question.
Go ahead.
So I guess in defining lobbying versus advocacy, in what instances or for what type of people or organizations would, I guess, delineating between the two, is it important? Like understanding that you can advocate, but you cannot go into lobbying.
So the question is, what type of organization, for what type of organization this line becomes important, right? Whether you're advocating or lobbying. That's a great question. So for the most part, in the broadest sense, it would be for any government agency. Usually it's frowned upon if you're lobbying, if you're a government employee, but you can advocate, right? And also nonprofit organizations. If you're a 501c3, you're really not supposed to lobby. Like all your work as a 501c3 is education work, right? If you're a 501c4, then you can lobby. So this is, sometimes you have nonprofit organizations, they have an education fund branch. That's a 501c3, and then they have an action fund, which is the 501c4. So it depends what kind of organization you are. But those are usually the two kinds, nonprofits and government.
Awesome, thank you.
You're welcome.
We have a question, but I do also want to mention that we have both versions of the 1-pager and the 7-pager on our website that mentions the bill and does not mention the bill. So if you know that you cannot do any type of lobbying, we do have a separate document that has no mention of HB 49, and then we have a whole separate one that does mention HB 49.
Do you think people can hear you?
I believe.
Okay, hopefully they can.
Can we mention it again?
So Rebecca's saying, for those of you online, if you go to the website and click on that advocacy page, there's all the materials, the 1-pager, the 7-pager, there's one for advocates and one for lobbyists. So there's scripts and materials that you can use that don't mention the bill whatsoever. And then there's materials and bills that have all the educational components and mention the bill. So you're covered either way.
And then we have a question from Shay. Great question. Are you able to mention that the bill is in the House without a pros and cons push?
I would stay away from mentioning a bill that's been introduced at all. So in case of HB 49, I would go and say, hey, legislator so-and-so, I work for the health councils, or my family has benefited from the work of the health councils. I'm a strong supporter of health councils. I know that you guys are going to be looking at this issue this session. Please support health councils, and leave it at that. So like very vaguely, like don't even mention the actual bill to be on the safe side.
So another question is, so the Google form that was dropped into the chat for signatures, was that structured as strictly of support, as a support for not a vote for? Yeah, so the letter they're asking, so we just sent out a link to sign on as a letter of support for health councils. That specific link we did send, I think we will put HB 49 on, but typically the letters of support we send out are strictly supporting health councils. If we send them to legislators, we strictly say, look at all these people that support health councils, like here a letter of why you should support a health council, and then here are all the people that agree with this letter.
Great. So if there is a letter circulating around for signatures, right, to support, endorse something, just make sure that you read it. You read it through. If it mentions like, hey, support this bill, vote for it, then you make a decision, right? Whether you're able to sign it or not, depending on who your employer is, what you're able to do. Did you have a question?
Yeah, my question kind of segues back to the topic around who should be concerned about delineating between lobbying and advocacy. The Health Equity Council in Bernalillo is a 501c3. We don't have a 501h branch where there are very clear lobbying percentages depending on your income level. So I've been researching into the IRS code, and what I found is that it says for a 501c3, you could potentially be have your status revoked if the organization conducts what they consider a substantial percentage of time, volunteer resources, and then overhead and other things that are funded towards lobbying work. And so I'm wondering, we do some grassroots, what would be considered lobbying. Does anyone have a rule of thumb or some kind of a metric as to what is substantial for a 501c3 when it comes to the percentage of resources that you're devoting directly towards lobbying, whether it be direct or grassroots?
That's an excellent question. So the question is, 501c3s are allowed to do a little bit of lobbying, but it's like a little vague, right, as to how much or what kind of work. Rule of thumb, in the work that I do, and I do 501c3 work, is that you should keep any lobbying, try to stay away from lobbying work altogether, because you don't want to get in trouble with the IRS or anybody else. But that percentage is under 20%. So under 20% of your time, your staff, your resources, your budget can go into grassroots lobbying, right? But be careful about that. I mean, I like to be really clear about it. My 501c3, we don't lobby, and that's that. Thank you. we
It's not a
good?
question, I just have a question.
Yep.
Would you say that's the same rule of thumb for signing a letter?
Signing a letter that asks a legislator to vote for or against the bill, yes, that would be part of that. Mhm.
Yeah, no more questions.
All right, so let's go to the next slide. And here we have two examples, right? My thought was we're gonna have a room full of people and people can yell out what they think it is, but we'll go with what we have. So the first bullet point here, I'll read it out loud. It says, this is what you would be telling a legislator, right, or a decision maker. The Juvenile Justice and Delinquency Prevention Act regulates the incarceration practices among juveniles, including institutionalizing status offenders. Research shows that incarcerating low-risk offenders is related to higher recidivism rates. What do you think? Is that lobbying or advocacy? Why?
It's just information.
It's just information. There's no bill attached to it, right? Now, we go to the next point. We urge you to support the Juvenile Justice and Delinquency Prevention Act to reduce incarceration of low-risk offenders and lower recidivism rates. It's lobbying because it says we urge you to vote a certain way, right? So it's kind of the same information. Actually, you're giving more information. The first bullet point is more educational. The second point, you're just kind of like asking them to do something. You go straight to the ask. The first point is giving them information. To our point in terms of health councils and the funding for health councils. New Mexico health councils link the state health department to critical community-based health planning. County and tribal health councils successfully involve community members and advocate for diverse and underrepresented communities. But from 2013 to 2022, county and tribal health councils receive well under 10% of what is considered to be an adequate level of funding. We need to support our county and tribal health councils to support the health of our communities. What is it? Advocacy, because why?
Information.
And we're not mentioning a bill, right? Well, we're close, but no cigar. Okay, the last bullet point. We urge you to support HB 49 to give New Mexico health councils the financial resources they need to carry out critical public health functions based on community data, need, and priorities. Without proper state funding, our health councils aren't able to do their work, thus undermining their important contributions to long-term community health issues. It's lobbying because you're mentioning right there, we want you to vote for this bill. However, both of these bullet points, you're providing a lot of education, right? So like on the Delinquency Prevention Act, that lobbying ask was just the ask. In this example of for HB 49, you are asking the ask, but you're also including a lot of education. So just sort of pay attention to that, right? Because I go down to the roundhouse and I see people running into their legislators and they're like, Senator, support bill so-and-so. And it's like, there's no conversation about what the bill is, right? That senator is hearing from 60 people about 60 different bills. Do they know what you mean when you say HB 49? If you don't provide a little bit of education about it. So when you're talking to your legislators, if you're advocating, you absolutely want to educate them. If you're lobbying, you also want to educate them, right? Even as you're making an ask for them to vote one way or another. All right. Any
One
questions?
question, yeah. So, we said, our health council is not a 501c3. We have no official status other than currently being recognized by the county as an official health planning body. As a health council steering committee member appointed by our county commissioners, do I need to be worried at all about lobbying by signing either an advocacy letter or a lobbying letter as a health council member?
You absolutely don't have to worry about the advocacy letters, but for the lobbying letter, I would check with your commission, right? What do you think, Rebecca?
No professional.
I mean, you're not a 501c3, you were appointed by a government body, right?
Yeah, I mean, just recognize, not appointed, recognize.
I mean, I think that's really safe for you to lobby as an individual, but I would check in with whomever's recognized the council that you're working with. Good questions. All right. Now we're gonna move into the elevator pitch. So what is an elevator pitch? Joyce?
She signed that and just leave off her title for the advocacy stuff, and then she's just a person saying, I want you to support this bill. Would that be okay?
Yeah, that's an excellent point. And actually, I do that a lot, right? Where I sign up for public comment or I sign an endorsement letter or whatever, even if it's a bill, I sign as my own person with my address as like a resident of Santa Fe, right? And I don't put in like my name and then my title, my organizational stuff. So you can always do that. Again, as a private citizen, you're allowed to lobby, you're allowed to advocate. You just have to be careful to like tie your employment to that. Okay, so the elevator pitch. The elevator pitch is basically a short speech that you have memorized in case you get a chance to talk to a decision maker. If any of you have been to the roundhouse, right, you know that it's crazy and people are coming out of committee and like getting into the elevator, and sometimes you just happen to be trapped in the elevator with your senator, and that's an opportunity that's golden and you can't let it pass. So the elevator pitch is like a 2 minutes or less little pitch. You wanna sell them on something, you want to change their mind, you want to solidify the way that they're feeling about a bill. And you just have a very limited amount of time. This is why we call it an elevator pitch, because it's, you know, the time that you get when riding from the first floor to the third floor with somebody. The goal is to plant a seed of curiosity so that after the proverbial elevator doors open, your audience, your senator, your decision maker is curious and wants to know more, right? They'll say, I'd love to keep talking about this, come find me, or that's really interesting. Do you have a one-pager on this issue? So it's a golden opportunity. You want to get good at this. You really can't wing it. You need to have something prepared, because when the time comes, it's chaos, right? And you just want to have it pat. You want to have something that you practice with your, I tell people to practice the elevator pitch with 3 different people. If you have these people in your life, right? Somebody way older than you, like your grandma, somebody way younger than you, like your nephew, and somebody who just has a completely different life experience from you. So like if we're talking about health councils, talk to your friend who works at the bank and knows nothing about health councils, right? Talk to somebody who's completely removed from your world. And just practice it, get their feedback, change it up, practice it 10 times, and then you'll be ready to, you know, get that opportunity and leverage it when it comes. You want to be passionate about the things that you're talking about. You want to be concise and you want to be succinct. And again, you just practice, practice, practice. The last thing you want is to have that golden opportunity and then you fumble and you get tongue twisted and then you lose your audience and perhaps create more harm than help for your issue. Let's go to the next slide. So again, I don't want you all to wing this, right? Prep it. If you're online and you have a little piece of paper and a pen, bring it out. If you're in the room and you have a little piece of paper and a pen, bring it out. You want to prep. You want to think about who your audience is. You want to think about what your purpose is, what your context is, what your credibility as an individual is. You want to think about the emotions that you want to elicit in your audience. And you want to think about the facts. So we'll go through these one by one. in the next few slides. So your audience, before you begin, we were just talking about junior funds. We were just talking about Gail Armstrong saying, reach out to her if your health council is wanting to get some funding, junior funds funding. So for the sake of this conversation and the rest of this presentation, let's think about Gail, right? Gail is your audience. You must be clear about who you're making your pitch to. Now we know we're making our pitch to Gail. Your pitch will be different if you're talking to Senator Campos or Representative Allison. Like, it depends, right? Who you're going to talk to is going to shape what your conversation is, what your pitch is. But for this purpose, we've got Gail. She's our audience. Do a little research, find out what she cares about, right? Find out how she's voted on some of these issues before. You don't need to get in the weeds about it, but you just kind of have to know, right? Does she care about children? Does she care about education? Does she care about the environment? Like, what are the things that she really cares about that is going to catch her attention if you talk to her, if you relate to her on those terms? And then also, what power do they have? You got to be careful, right? Because you might have a great state representative who you know personally, who you like, who's definitely going to listen to you. Great. Are they on any of the committees that are going to vote on your issue? If not, that might not be your where you want to prioritize these conversations. So figure out who you're talking to, figure out what they care about, and figure out what power they have. Are they actually able to help you move your bill, your issue forward? Let's go to the next slide. Once you figure out your audience, what they care about, what power they have, think about your purpose, right? What is it that you're trying to achieve? If all goes perfectly well, best case scenario, what is the outcome that you want to see from all your advocacy and all the work that you're engaged in? Based on that, right? So in this case, the purpose is to get funding, to get junior funding for your health council. That's the North Star. That's what you want. In order to do that, to get that, what do you need this person to do? What do you need Gail to do? So we were talking with Brenda a little while ago. What if Gail is not your representative, right? Well, Gail said that she wants you to reach out to her to get junior funding. So the way I read that is that she's willing to advocate for you with her colleagues on the committees that are going to vote for this, right? So that's the purpose. You want to talk to Gail because she's made herself available to help you. You want her to help you, and that's the ask. So let's go to the next slide.
Next slide, Terry.
Your context, before you draft your elevator pitch, you also want to get a little information about if this issue is a hot button issue, if people are talking about it, if they're not, if people are talking about it, what are they saying? What is the opposition, right? Saying if you're trying to get junior funds for your council, who is talking to Gail and other representatives saying junior funds should absolutely not go to the health councils, and this is why. You need to know what the narrative is. So yeah, just get a little information about the bill, the issue, the people care about it, if people talking about it, is this a bill that seems like it's going to skate through? Or are there people that are trying to stop it from going through? So that's your context. Let's go to the next slide. Your credibility, this is important. So again, you'll have maybe 2 minutes, right? With whomever it is that your target audience is, in this case, Gail Armstrong. You need to figure out how you will present yourself when you open up your elevator pitch, right? Hello, my name is Maria Perez. Right? What is it that gives you credibility to talk to this person about this issue? You can say, I am a coordinator for my health council in my county or my tribal council. You can say, I work with my health council on, drug prevention or vaccination education, whatever it is. Like, how do you present yourself so that immediately that person that you're talking to says, okay, I should pay attention to this person. They're credible. They they have information that I should be listening to. If you just present yourself like, hi, I'm Maria Perez, I want to talk to you about this or that, they have no context, right? They don't know why you should be considered an expert or consider a credible source of information. Let's go to the next one. This goes back to our storytelling training that we did some months ago. It's important to know what emotions you want to elicit from your target audience. And this really depends about what they care about, right? If somebody already cares about health councils, as is the case right now in our example with Gail Armstrong, what is the emotion that you want to elicit from her, right? Is it rage? Is it hope? What is it? Is it curiosity? Is it inspiration? What is it, right? It's going to be very different from somebody who's already predisposed to support your issue than somebody who maybe is predisposed to oppose your issue or just has no idea about your issue. Or a lot of these newly elected representatives probably don't know much about health councils, right? They're kind of like a blank slate. So like, do you want to inspire them? Do you want to give them a sense of impending doom? That you have to be very strategic about this. Once you figure out what emotion you want to elicit, then you figure out what story you're going to tell them. The way that we elicit emotions is by telling people little stories, right? You have 2 minutes to tell someone their story, this story that you're going to tell, maybe 1 minute if you leave time for other conversations. So what is the story that you're going to tell? Are you going to tell the story about how in your community, your health council did this thing and it was amazing and it changed the lives of people, including your auntie? Or are you going to tell a story about how when the funding went away from your health council some time back, the mortality in your county went up by X percentage because all of a sudden there wasn't that support and that network, right? Very different emotions. So figure out what it is that you want to elicit and then craft your story around that. Let's go to the next one. And finally, the facts. Before you talk to somebody, you have to be clear about some facts. And you don't have to be in the weeds about it. This is where the Alliance comes in super handy because they have that 1-pager, they have that 7-pager. So you already have information about the facts, what is considered adequate funding for health councils, when did the funding go away, what happened, what happens when councils are properly funded. They have citations, right, to like different studies and reports and things like that. So you want to make sure that you have some sort of fact sheet that you're going to bring to you when you go lobby or advocate, right? If you're lobbying, your materials will have the bill number and the ask. And if you're advocating, it won't have the bill number, but it'll have all the education, all the facts. So before you head out to talk to any legislator, make sure that you have a 1-pager so that when the elevator doors open and they say, tell me more, you say, here you go. I'll follow up with you in a couple days. All right, do we have any questions? Okay, so let's go to the next slide, please. So this is the part where we're going to work, hopefully have a little practical application. So think about this, right? You're talking to Gail Armstrong. In 15 seconds, I'm going to give you a minute to think about this. How are you going to introduce yourself? How are you going to greet them? How are you going to present yourself? What are you going to say about yourself that makes you a credible source of information? And how are you going to tell them in a nutshell what you want to talk about, right? So this should take, it may take like 10 minutes to draft in reality, but it's going to take 15 seconds to convey. So just take a minute and jot these thoughts down. How are you going to greet them? What is your name? What is your, why are you a credible source? And what is it that you want to talk to them about? And then if we have anybody on the Zoom who wants to be put on the spot and share, that would be great, or anybody in the room, our best live audience.
We have a taker.
Shay, go for
All
it.
right, I jotted it down just real quick. Hello, my name is Shay Yantis. I'm the coordinator for the Catron County Health Council. And I would just briefly like to speak with you regarding the importance of health councils in our communities across the state.
Perfect. Thank you, Shay. I didn't time that, but I think that took less than 10 seconds. Do we have anybody else that wants to share?
Just the intro part?
Yep.
Sure. So that. Hi Gail, I'm Jessica Strong, the Social Services Manager from Los Alamos and new to our county's Health Council. And would love to talk to you about the important work that health councils are doing across the state.
Perfect. Thank you so much. So not a whole lot of in the weeds information, right? But like you caught her attention. You introduce yourself as a credible source and you make clear what it is that you want to take, 2 minutes away from her to talk about. Perfect. Okay, let's go to the next slide, please. Okay, next you're gonna say that, she's gonna say, okay, great. And then it's your turn, right, to actually present your pitch. So how will you present the problem as you see it in 40 seconds or less? So you want to state the problem. You want to illustrate it using a vivid storytelling. Remember, you're going to do this in 40 seconds or less. So the story is like very short. If possible, the story is about yourself, about somebody in your life, your parent, your kid, your partner, your neighbor, right? The students in your school, something that is very personal. You don't want to talk generally about some people out there in the community. It's like you want it to come from your heart. That's going to elicit the emotion again. So what is the vivid story that you're going to tell? You want to back it up with one data point if you can. And you want to connect it to why, in this case, Ms. Armstrong should care about it. So try to, take a minute again to quickly jot some thoughts about this. What is the problem as you see it? Illustrate it with a story. Back it up with one data point and connect it to why she should care. So I'll leave you a minute or so to do this, and then we'll get somebody to volunteer. It's weird to do this, not seeing anybody.
Everybody's down.
Yeah. Yeah, I wish I could see your faces on Zoom, but I have my lovely audience here. All right, do we have any volunteers? And we can just go point by point. So anybody want to share how you state the problem as you see it? Anybody? Let's have you, Brenda.
I'll give it a try. So I would start with saying, as you know, the CDC has determined that fentanyl is one of the #1 leading causes of death in adults ages 25 to 45, just recently stated that. And our health council has been working very hard because we've lost so many of our people due to overdoses. So we've been working very hard to train our community in responding to overdoses and save lives. And we'd like to have your continued support in our efforts.
Awesome, Brenda, you hit all of them. So I'm gonna paraphrase for our folks on the Zoom. So Brenda said, stating the problem, right, that as you know, Gail Armstrong, the CDC has come up with some studies that show that fentanyl is a big problem and it's causing the death of thousands of people in our communities. Illustrated using a vivid storytelling. This, I think you could fill out a little more, right? She said, in our own community, our health council has been doing a lot of work to educate the community and try to prevent some of the fentanyl deaths. We've had some fentanyl deaths in our community. It would be great to say, be a little more specific about that, right? Like in our schools, we've lost 5 students, or my colleague, whatever, right? So like it's a personal thing. And then she said, we would really love your continued support to our health councils because we're doing this important work. Something like that. Did I sort of get it?
Pretty good.
Okay, cool. So that was great. 30 seconds maybe for that, right? Let's go to the next, unless we have somebody online that wants to share. Any hands? All right, let's go to the next slide.
Or not.
Okay, so you present yourself, you present the problem, now you present the solution, right? You definitely don't want to be a bummer. You don't want to just leave them hanging with the problem. You want to leave them hanging with the possible solution. So again, in 40 seconds or less, state the solution. Again, illustrate it with vivid storytelling. Hopefully this ties into your little story that you told while you were stating the problem. Back it up with one data point if appropriate, or if you have it. And then hand them your data page, right? Your one pager. So let's give you all about a minute to jot some thoughts down about how to present the solution. How do you state the solution? How do you illustrate it with a story? How do you back it up with one data point if you need to? And then what do you say as you're handing them over your one pager, your fact sheet? So take a minute and then hopefully somebody will volunteer. Do we have anything in the chat? Okay. All right, how are we going to present our solution? Do we have anybody? Any hands up? All right, live audience. Who wants to go?
The solution for Brenda's or the solution for like
Yeah, sure. The solution to Brenda's point is, as we had that as an example before. How would you state the solution? Like, what is the
With
solution?
increased funding, we will be able to have the materials to educate and help the people in our community to be able to take care of themselves and to know that there are options for them to do something other than substance misuse, and we can provide them with more mental health benefits and ways to address those needs instead of turning to substances and self-medicate. We
Perfect.
really appreciate your support to have that happen, not only in my county, but in the counties across our state.
And then you hand her the one pager and you say,
Thank you. I appreciate your time.
perfect. So Joyce is saying, Joyce and Brenda from Quay County, right?
Yeah.
So Joyce presented the solution just straight to the point. You don't have a lot of time, right? So she said, increased funding for our health councils will really allow us to do the work of supporting people, educating people, have the tools and resources so that we can make sure that in our community, folks are not turning to substance abuse, that there's options, that there's places where they can get help. I'm totally paraphrasing, but right, that's the solution as you stated. We were missing a vivid story, so can you pull one out of your head right now?
We actually have somebody on our health council who is a recovering user and has helped us tremendously to make connections and inroads with a demographic that as a health council, we haven't been able to reach before. So we are so excited that we are actually breaking into these areas that we need to help people. We need to help our community. And so really appreciate your support.
That was excellent. So Joyce's story was, we actually have, it's a true story, she says. Yeah, and we trust her. She said there's a member of our health council who's a former person who's been struggling with drug addiction, and he's been tremendously helpful to our health councils in reaching that demographic that as a health council, maybe we don't have direct connection with. And having that help, having resources will just make a huge difference in our community, something like this, right? But all of a sudden, there's this person, right? There's this individual that you're connected with who has dealt with this issue in their own lives, who has overcome something. There's nothing like a story of overcoming adversity, right? So all of a sudden you have her ear and she's feeling it in her heart and she says, man, yeah, that's powerful. There's this people that can help us link to this demographic of folks who are struggling with substance abuse. Health councils can support those people, right? Then she handed the one pager, the fact sheet, and she said, thank you so much. We count on your support. Have a wonderful day. That's it. Okay, great. Let's go. Yeah.
Sorry, I don't mean to interrupt, but Valeria is asking that when we conclude here today, if everyone can join them in room 307.
Okay, so if everyone online can also join room 307 for the hearing after we're done with this, we're going to be done in just a couple minutes. Do we have anything on the chat? Okay, let's go to the last. Next slide. Okay, and the ask. This was already included in Joyce's pitch before, but basically, if you haven't made an ask, you've wasted your time and you've lost an opportunity and you've wasted their time. All of this, like saying the problem, stating the solution, backing it up with a vivid story about somebody in your community that's an actual person whose life has actually been touched by this. If you don't say, therefore, I'm asking you to blank, it's a waste of everybody's time. So make sure, sometimes it's hard to make an ask, right? It's not the most comfortable thing to do. Make your ask. This is the whole purpose. Remember when we were talking about what your purpose is to get this funding, right? You're not going to get the funding if you don't make the ask. So in less than 10 seconds, tell them directly what you need them to do. Ask them directly if you can count on them to do it, right? It's not enough just to say, I want to ask you to support this bill, because they can be like, okay, they're not on the hook, right? But if you say, can we count on you to support this bill? They're either going to answer yes or no, or they're going to deflect. And then you know, right? You know that they're not likely to support it or that they need more work. So let's have somebody directly make an ask. And how would you say this? Live audience, unless there's somebody online that wants to do it.
Okay, I guess.
Remind me your name. From
Jessica.
Jessica from Los Alamos. Okay, what's the ask?
So Gail, can I ask that you support funding for health councils across the state? That side question, is that still advocacy? I'm just asking for general support, or is that crossing the line?
That would be lobbying, because you're asking her to support a certain outcome.
So ask, Gail, can I count on you to support health councils however you can? And I will follow up with you in a couple of days
Yep.
if you have any questions.
Right, so that's on the advocacy side, right?
Yeah.
So like on the advocacy side, Jessica saying something like, Gail, I want to ask you to do whatever you can to make sure that, that health councils are supported throughout the state. We didn't say, can we count on you to do this? But she did say, I will follow up with you in a few days to see how your efforts are going, right? That's on the advocacy side. You could also say, because Gail, you know that Gail's gonna vote for this, right? So like, you're not asking for her vote necessarily. You're asking her to advocate with her colleagues that are on these committees that are gonna vote on this. So that's the ask for Gail, right? Gail, thank you so much for your time. I'm gonna ask you to please work with your colleagues so that they will vote to support this bill. If you can lobby or work with your colleagues so that they will support health councils if you can't mention a bill, right? Can I count on you to do that? You know, my representative is so-and-so, they're on this committee. I'm not so sure that they're supportive of this. Can you please help me get my representative to support health councils? So you want to be really clear about what your ask is, and you want to put them on the hook, right? So it's not just like, if you possibly could, it would be great if you might think about helping, right? It's like, I want you to help, and I'm gonna count on you, and I'm gonna follow up with you to see if that happened. Great. Do we have anybody online that wants to add anything, share anything? Or do we have any questions on the chat?
Could you ask them to share your story with their colleagues?
Yes,
Or to support health council?
that's a great question. So Joyce is saying, can you ask Gail or whomever you're talking to share the story that you shared with them, right? With their colleagues. You absolutely can. Not only that, but you can have that story as a little blurb on your one pager, right? There's little videos that you can put on social media and like share with, you know, at Gail Armstrong. Here's a little video about my story, my community. So there's, again, nothing like storytelling is going to move people, right? To feel a certain way, therefore to act a certain way. So always, in any way that you can, make sure that a story is stuck in there, even if you're not talking to someone directly. Yes. All right, next slide, please. Okay, so you are done. You wrap it up. You thank them for their time and attention, and you tell them what your next step will be, which Jessica said, I'm going to follow up with you in a week or whatever it is. What you're going to do, or you're going to say, thank you so much for your time. I will follow up with you next week, or I will talk to my representatives who are so-and-so and so-and-so, or I'm going to go back to my council and tell everybody that I had this excellent conversation with you. Tell, you know, you're asking them to do something, share with them what you're going to do, because it's a partnership. Now you're working together. Okay. Let's go to the next slide. Now you put it all together. So if you've been taking notes, just jotting down your thoughts on the Zoom, you put all your little jotted thoughts together, and then you speak it, right? You read it out loud. And this is your checklist. Is this under 2 minutes? If it's not, don't speed up. Edit some things out. You don't want to be talking at somebody really fast. That's not a good advocacy practice. Does it have a good flow? Do you feel like you're, you know, presenting yourself, stating the problem, stating the solution, telling your story, making an ask, right? That's the flow. Are you comfortable with it? Do you feel like your point is getting across? And once you have that, you have your little blurb, your little elevator pitch. It's under 2 minutes. You feel good about it. It has a good flow. It's making your point. It's time to practice. Again, if you can do it with your grandma, with your nephew, with your friend, practice, practice, practice a few times. I say no less than 10 times. And then you're ready to go down to the roundhouse, find Gail Armstrong, and share your elevator pitch with her. And again, you can do an elevator pitch for any audience. So you might want to prep one for Gail Armstrong, but it might be good for you also to prep one for your representative who's going to be voting on this issue, who may or may not be supportive of this, right? So that's where that research in terms of what do they care about, what is their vote history like, right? just make sure that you're speaking to your audience with some knowledge of who they are and how to move them. All right, I think that's it. Do we have another slide? There's the thank you slide. So thank you all, this beautiful live audience. And everyone on Zoom. I hope that was helpful, and I hope you all will draft an awesome and moving elevator pitch and start doing either your advocacy or your lobbying around this this issue. Thank you so much. Have a good afternoon. Yes.
So in terms of, tribes being able to advocate, are there any rules against that because it's, or are they treated as like governmental organizations?
I think that tribes would be considered governmental agencies or organizations, but just check, but just like anybody else, if you are a member of a private pueblo, you can advocate or lobby all you want as an individual.
Just not the tribe itself.
Right.
Okay, thank you.
Thank
We have a lot of comments in the chat. Thank you, very informative. Thank you, Maria. Thank you so much for this information. Being new to this process, this was very helpful.
Awesome.
Even though we couldn't see them.
Thank you so much for.
Thank you, everyone.